Thank you very much, Amanda. Thank you very much, Hilltop. It's really fun to do this together with Hilltop Bio. Hilltop is our foundation partner for a long time. And with our foundation partner, I mean the foundation partner of Ignite. It's an interesting group of vets, farriers, trainers, riders, scientists who would like to improve the outcome and the output of our sport. And for 3 years already, on one evening a month, we have our Ignite Rehab rounds where we talk about how to rehabilitate horses from injuries. And all the aspects that are part of it can be the shoeing, as we have our topic today. It can also be physiotherapy, name it. Myself, I'm Joop Lomans. I'm the Executive Director of Ignite and wish you very welcome to this meeting. The system is quite simple. Bart will give a presentation of his case, about 20-25 minutes. Then we'll have Didier as a farrier, an expert on the case, to come up with a few questions for Bart, or Bart might have some questions for Didier. And then there's 20 minutes left for you to join us in a conversation with questions that you have regarding the topic and the animal. So to start with Bart. Bart, welcome. Nice to have you here. Bart is a veterinarian from Belgium. He works a lot in the United States. He's board certified in sport horse medicine. He's a Belgium equine veterinary medicine a vet. And let's start with the party. Bart, please present your case, and then we'll get DJ and the rest to chime in later.
Thank you, Joop, and thanks for the invite. Before I want to present the case, I got 2 slides because it's very important when we think about rehabilitation and rehabilitation the hoof at the same time, to understand that the hoof is a very dynamic and adaptable structure that will play an influence on your internal structures within the foot, but also the structures of the whole distal limb and the limb itself and the whole body. Dynamic means it's a 3-dimensional viscoelastic deformation, which we call the hoof mechanism, and it can respond to a rapidly applied force by an elastic deformation, which you see in the video on the left. And in that case, the foot will return to its original shape very quickly. And when we try to influence the elastic deformation as a farrier or a vet, our trim and shoeing will be more focused on obviously influencing the dynamic phase or the movement of the horse. But the hoof capsule can also respond to slowly applied forces such as posture, stance, conformation, or abnormal forces, exercise-induced repetitive overload, in a plastic deformation, and in that case, the hoof capsule returns only very slowly to its original shape or stays permanently distorted. So if we want to influence that as a vet or farrier, our trim and shoe will need to be focused depending on what the issue is. Posture, conformation on the trying to achieve static balance, and where it's more from a repetitive overload, try to focus on dynamic balance. And the picture in the middle, that's a conformational issue, causing the inside to be loaded and the outside to grow faster. And the 2 images on the right of your screen, that's obviously repetitive overload in combination with a conformational issue, which lead to medial heel shunting. So in that horse, you're gonna more focus on dynamic balance with your trim shoe, versus in the middle picture, you're gonna focus more on achieving static balance. So it's very dynamic and it's very adaptable. We often forget that. You can compare it to a muscle. It will adapt to the load and stresses placed upon it. And even if you have a very distorted hoof and a very old horse, that foot can still adapt and change to become a healthier foot. But for a hoof to adapt, there's 3 criteria that need to be met. It's very important to understand that. The hoof needs to be able to move and again, you'll see it's a team approach. In that first part, the farrier plays an important role, allowing that hoof capsule to move as a unit, but then we're mainly talking about lateral flexibility, side to side, and heel movement, expansion, contraction. But allowing it to move is not enough. It obviously needs to be exercised, and ideally in a pain-free manner, because if there's pain, the foot is not going to be loaded as much. So the adaptation or improvement in strength and health will occur slower. So there, the vet can help with the pain management. The farrier can have an influence, obviously, on having taking the pain away to a certain extent if we talk about sole pain or heel pain. And the trainer's job is to move that horse in a proper way. And once the horse is pain-free, the foot is allowed to move and it's exercised, then we obviously gonna have to adjust that exercise stimulus for continuous adaptation to take place. Just like you go to a gym and you start lifting weights, you start with 5 pounds. If you don't increase that, you're never gonna adapt further than what you're adjusted to. You're gonna have to increase the exercise to 10 pounds or more repetitions, and so on. So those are the 3 criteria to get a stronger, healthier foot. It's not just the trim and the shoeing. It's not just the farrier. It's a team approach. And the hoof also adapts obviously to its environment. So depending where you are, you're dealing with a different environment. The hoof will adapt to that. You'll have different type of hoof shapes and issues, and many other factors play obviously a role, genetics, diet, trimming, and so on. But one thing is sure, when you stabilize a hoof, it will weaken over time. And that's what I try to, with this case example, and in general try to do in my practice, is try to make that hoof stronger, try to get away from stabilizing that hoof. Stabilization is good in an acute phase for a short period of time when we need that to protect that hoof or certain internal structures. But in the long run, it will just continue to weaken it, and then you get in a downward spiral where you're gonna need more and more support, more and more stability for that weakened structure to try to kind of keep everything together. So because the hoof is adaptable and dynamic, we call it a smart structure, and that's where the no foot, no horse comes in for, because a smart structure influences the function of other parts of the body, and that's why we want to integrate hoof health in our rehabilitation of a certain injury or pathology. The case I'm going to present is a quarter horse with navicular disease. As we all know, navicular disease is quite common in quarter horses. This is not a high level performance horse, but it's used for trail riding and pleasure dressage. And it's middle-aged. This is his medical history before I got involved. It was bought back in December 2020. At the time, it was barefoot and sound. But as many horses, especially in California, this is a horse in California, the ground gets very dry and hard. The feet start wearing more than they can grow. And a lot of these horses, even if people try to be barefoot, they start to get footsore. So for that reason, the horse was shod with a regular rim shoe, as you see in the picture, which is a good idea. It gives you the protection, protects from excess wear, and it also gives you traction on the trail. The horse was initially better, so job well done, but then it became lame about 4 months into it. And also notice a little bit the time intervals when the horse was in shoes and then initially better and then lame again. And that's sometimes we see often, and it's also something to consider why we have to adapt our shoeing over time and not just leave the horse in one specific package for the rest of his life, because they can be good with a certain package for a certain period of time, and then it seems like things regress, and then we have to adapt, obviously. So the horse got lame, had a thorough workup in May 2021 at a referral center where they noticed a left front 3 out of 5 lameness, worse on the circle on the left. It had an MRI and a PET scan. It blocked to a PDN block, and the diagnosis was quite moderate navicular bone degeneration, as well as a remodeling of the palmar processes, especially the medial one. There was also some mild enthesiopathy of the flexor surface where the DDFT attaches, but the DDFT was not affected. He had some similar changes in the right front, but the left front was the main issue. At that time, this was the treatment plan prescribed to the regular vet by the referral center. The horse got OSFOS for the bone edema or the bone contusion and inflammation and the remodeling and the degeneration, and the coffin joint and the bursa was injected with HA and betamethasone. It was had some relative rest for about 2 months with stall rest and walking, and they recommended shoe with pads. In this case, the horse went in this type of Avanti PLR shoe and a shock absorption pad. So typical what a lot of people would do for navicular disease. A shoe with a nice breakover, especially at the toe. This shoe was not wedge, but the PLR shoe gives you a little bit of a dynamic wedge, if you like, and then a shock absorption pad, a full pad, which also gives you some extra heel support. In this horse, there was no response to the treatment and management plan. And I got involved then about a year later in July 2022. And the horse, the videos might be a little slow, so it might be hard to see, but it was still obviously lame. Left front going left, especially on the hard ground. Was better on the soft ground, but still showed the lameness there. So basically, in the last, almost 2 years, the lameness had not improved at all, despite standard treatment and shoeing protocol for navicular disease. As it had been quite a while, I blocked the coffin joint just to make sure most of the lameness was related to the foot, and in my opinion, it blocked 90% to the coffin joint. And my treatment approach at that point in time, I treated it with Prostride in the coffin joint and gave it IV zoledronate, a very strong bisphosphonate. And I do integrated sports medicine, so I always treat my patients with physical medicine, chiropractics, acupuncture, physiotherapy. I do a whole horse approach. And as this horse did well barefoot before, when she bought it, he was sound, and the problem started when she started shoeing. I recommended to go back into barefoot, and in California, barefoot is not easy to accomplish because of the hard ground and the environment horses live in. They're hard to adapt, so we then often use boots to help them out. And I recommended more exercise, so instead of a stall and just exercising under saddle or in hand, I recommended pasture turnout. So what I try to do here is, free up the foot, allow the foot to move, and then follow by exercise so the foot can become stronger and healthier. And especially we're dealing with navicular disease, we want to try to strengthen the back of the foot. The frog, the digital cushions, which is the frontline receiver of descending shock, and also support the navicular bone. So if we can strengthen the back of the foot, then hopefully my long-term plan is to get the load of the navicular bone. You're not going to cure the navicular disease, but you can make that horse functional. So that's a little bit the plan at that point in time. Granted, you will see over time that this case could have gone better because it's also a team approach, and you have to get the owner agreed with a certain shoeing protocol, the farrier agreed with a certain approach. You're not always can do what you want, even if you suggest certain things. But that's what we went for. And then if we think about the pathology, and the horse is going lame left on the turn to the left, this is kind of what happens at the level of the navicular bone. These are pictures from iCell Denois, which explains that you put pressure on the lateral aspect of the coffin joint, and also pressure on the lateral part of the navicular bone. And the X-ray is his navicular bone, where you see radiolucencies more on the lateral part of the navicular bone. So in those cases, you can think a little bit how we are shoe. You will try to reduce the pressure on the lateral side of the left front foot, maybe provide some shock absorption, as well as we're dealing with a bony pathology. This is the follow-up, so 2 months post initial medical treatment and on barefoot. The owner report that he was improved, but there was still a lameness going left, 1 to 2 out of 5. And at that point, we just continued the barefoot and the exercise program. In February 2023, so we're about we started in July, 7-8 months into it. The horse was still lame, and at that point I decided to treat the horse one more time medically. I used a combination of Artramid and Stridaflex in the coffin joint. In my hand, the combination of those two has been very successful, especially for joint pathology or subchondral bone pathology. If it's an inflammation, I might use the Stridaflex first and then follow up with Artramid a month later, but sometimes I combine them together all at once. And we decided to give the barefoot a little bit more time, because obviously it takes time for a foot to change. I'll talk about that later, but I've been involved with research on twin shoes or split shoes, and we know from that it takes about 8 months for hoof parameters to stabilize and optimize. And we all know that it takes about a year for a total new foot to grow out. So we know it takes some time for some changes to occur, or other changes occur quickly. In May, the owner reported that the horse responded well to the last treatment of Artramid and Stridaflex, that he was sound, but they decided to put shoes back on because they noticed that the horse feet, the farrier noticed that the horse feet were wearing too much, and that he was getting footsore a little bit. So this is before I got to recheck him. The farrier decided to put a straight bar shoe on him with a hard plastic castle pad, so provide protection and support. It's a good thought from the farrier for a horse with navicular disease, especially that is currently footsore. So with the hard plastic pad, we take all the load of the soles. There's no direct impact. The sole bruising can recover. We give him the heel support with the bar shoe, so he cannot sink in with the heels in soft ground, and he has a little bit of a roller toe. Granted, it could have a little bit more of a breakover, but the shoeing package here was an appropriate decision for what the horse was dealing with at that point in time. So he was doing well, and then again, around 4 months into the shoes, similar like the initial history, he started to show some soreness again. On the video, you see it here, it's quite mild still, so this is not too bad. We're still pretty happy with that. But then about 6 months into the shoes, he became acutely lame, even at the walk here, you can see, and obviously very clearly at the trot. And at that point, the farrier had decided to add a wedge pad to his current shoeing combination, which again, as a navicular, we sometimes wedge up to improve the coffin bone angle and take the stress off the navicular bone and the caudal heel structure. At that point, because he was so lame, I took some new x-rays to see if anything had changed compared to the old x-rays, but we still see that the horse, the lucencies were similar of the navicular bone. We had some sclerosis as well. The balance was pretty good from a trimming perspective, but he did have a little bit of a low palmar angle. If we measure it, it's actually about 0 degrees there. And this is when I pulled that bar shoe with the hard pad and the wedge. This is how his foot looked like. You can see that he has contracted heels, with the frog being quite narrow and long. So for a healthy frog, we look for that 60% width to length ratio. And then we also see that the inside heel bulb is starting to shunt inwards and a little bit upwards as well. And there's also a little bit of an imbalance there in the trim, with the lateral heel being a little bit lower. So we see this horse by, I don't have a picture from his foot before when he was barefoot, but he had a really nice, healthy barefoot foot, which you will see later. But then once we put him in shoes, that was great. It gave him initial protection and support, but then obviously the caudal heel structure started to fail, which is then detrimental for the long-term health and functionality of this horse that has navicular disease. So we pulled his shoes again, put him on some bute for a couple of days, packed the soles because of the soreness in the heels, and then we noticed that his health improved. He was still let's see, when did I probably skipped it. In December, we put him barefoot again, and the owner reported he was doing fine, but 2 weeks before I came out, that he started showing lameness again. And as you can see from this video, typical lameness of horses that are footsore, as you can see there at the walk on gravel. So that's the problem with barefoot, especially in California, is that these feet wear quicker than they can grow, and they get footsore. So you try to get a healthy back of the foot by allowing that heel movement to take place, but a lot of horses cannot handle it because they get footsore. And if you boot them, then you lose a little bit some of the benefits, because they lose a little bit the proprioception and the feedback from the ground surface. But you can see that despite that, his overall foot health had improved a lot. You see, you have a quite normal frog ratio, a healthy frog occurring again. The medial heel shunting has resolved. So quite healthy frog, but you can see that he's wearing that lateral side excessively, lateral heel, lateral toe into the sole, and that's why he was getting sore. So we get a healthier foot, but too much wear, that's why he's sore. Now, how do we deal with that? Well, since quite recently, we have these split shoes. They're called twin shoes in the US, that basically protect the foot, but allow that a natural hoof mechanism to take place as they are barefoot. And so we put them in those shoes, kind of give you the best of two worlds. We know the horse does better barefoot, but he wears too much. And now we give him a shoe that allows that hoof mechanism to function, but also gives him that protection against excessive wear and also some extra support. And then we see that within 2 shoeings, the horse sounds up and is doing quite nicely. And at this point in time is still quite sound. These are the twin shoes. From people that don't know them yet, you see that they get split in the toe, and basically you get two branches that can move independently, and grow with the foot. So they allow an unrestricted movement of the foot. And then if you compare the health of the feet over time, even here in a quite short period of time, from December when we pulled the egg bar shoes into barefoot, within 3 months you already have a healthier foot, and then even 2 months later you see that frog health even improves more. You have a nice callus, and you have a nice healthy foot. And if you look at the heel bulbs, we kind of have the same. We go from these shunting, contracted heels opening up, and we kind of maintain that with a split shoe. So this is the case, and this is a little bit the clinical reasoning. I showed you this slide. From a shoeing perspective, we're gonna say, okay, we wanna reduce the pressure on the lateral side. We can do that with a narrow branch or a shoe that allows lateral medial flexibility to reduce the pressure on turns. We have to consider the stresses that take place on the navicular disease, and what causes those stresses. We know the palmar angle of P3 plays an important role there. We know that the length of the toe and the breakover plays an important role there. We know in general shoeing and shoe weight plays a role on stresses on the navicular bone. So if we think about which shoe we're going to use, we're going to have to think about those factors as well, which are listed here. And then we have to think at what stage of healing are we? Are we in an acute stage? In those cases, we generally need stabilization and protection. Or are we already in the repair phase? There we still need some protection, but we want to start to mobilize things so we can get it stronger. And if we're already in the remodeling or maturation phase of the process, there is where we really need to start exercising the tissue. So if you follow the stages of healing in your shoeing, you're gonna be better off as well. And then you have to think, obviously, which mechanical features can I influence with my trim or shoe, which structure is involved, which part of the stance or swing phase is the problem. In this case, we had a bony structure, and it's mainly at impact and push off and turns in this horse. So we want to make sure our shoeing and trimming addresses those areas. We have to think then where the hoof is in relation to the cannon bone. In this horse, he had a nice healthy foot that was set quite well under the cannon bone, so we didn't have to worry about that. But again, allowing the foot to move is the #1 criteria to allow a hoof to adapt and get stronger. So that is, then you have to think, how do I affect the hoof mechanism and function with my manipulation or intervention or shoeing. So that's a little bit my thinking process, and I made this slide to see a little bit what happens when we use a traditional shoeing approach. We often have an injury, we go into therapeutic shoeing, which is initially great. It prevents hoof capsule distortion, it prevents distress and allows a pain-free healing. But once the injury is healed and we keep him in therapeutic shoes, that usually then leads to hoof capsule distortion, because the shoeing is actually not appropriate anymore for that current situation. And we get into complications with that. With barefoot, the problem is that we don't protect the injury, and that horses sometimes stay painful and adapt to certain posture and movement. And that then can have hoof capsule distortions. But if we combine that approach by changing our shoeing during our rehabilitation, as the injury and the hoof health changes, then we can create a maximum outcome. So in this horse, for example, I probably would have, in the ideal world, started with traditional shoe, like an equilibrium shoe with a hard plastic pack to protect and stabilize. then quickly move into some type of polyurethane shoe like an Epona shoe to start allowing lateral flexibility and give shock absorption, and then move into a split shoe because that also allows heel movement to take place and allows the back part of the foot to become stronger, and then help in the in the prevention of and the restoration of the stresses on the navicular disease. So that would probably been my ideal approach, but with this horse, the owner also wanted to try barefoot, and so we struggled a little bit with that, but at the end we have a good result. So there you go, maybe a little too long, but that's my case, and that's my approach. I'll leave the word to Didier, our hoof care expert for today, to give his input, and then it's open for questions.
Go ahead,
Okay.
Didier.
Thank you. Now for me, that's a whole new case that I haven't seen yet, especially with a navicular disease in different stages. Just a little question for Bart. What do you think of just an egg bar shoe and a hard Castle hard plastic pad? Without it's just going to protect the sole, but it's not going to give support to that internal structure in a way, let's say, descending of the navicular bus, because he had a hyperextension of that coffin joint. So what are your opinions on using an egg bar in general with a minor breakover on that shoe?
Well, I think the shoe that we had here could have more breakover, and sometimes with naviculars, you like support, but a lot of these horses don't like the pressure, especially if they already have a weak heel structure. And that's where the hard plastic pad is sometimes nice, because it takes the pressure away from not the sole, but also the direct pressure over the heel and the frog area. So, and then over time, I try to increase the support and the pressure in the back of the foot a little bit. But some horses really don't like that pressure on the frog that then pushes into the navicular area, I've noticed.
Especially on the soft footing, that you have your branches of your hoof are going to descend in the sand and will give too much pressure for such a horse. And for me, and I still have to take in consideration of his low palmar angle, that low PA and that medial bruising of that palmar process. Depending on what's causing the pain is impact, and with an egg bar the impact will be a little bit more worse. The heels will get more impact because of that egg bar or straight bar, and there's no protection except for that hard pad, that Castle pad. Like, I just have a little example here. This is an example of a center bar. A center bar is just above the navicular bone. So if you look at it in this way, and I'm just going to try to show it. I had some samples here like this. The center bar is really nicely below that navicular. So this will give a little bit of protection, and also it has the same function as an egg bar. It prevents of the heels descending down, so you have a bigger leverage for that push-off phase. So this could help in that first acute stage where the pain is really localized in your on your navicular bone, to have a little bit protection. But also some horses do want that support, because I had another case where we had bony changes and not bursitis, but because of he was walking on gravel, that center bar just went down and pushed against the frog, and the horse wasn't much more lame than before. Even he was sound with that support, that pressure on his frog, supporting that complete internal structure. So it's a little bit case depending, and also, like you said, it's a team approach. The vet needs to know and has to diagnose really well before we can apply a shoe, a proper shoe,
Right.
in the several stages of that rehab. And
Yeah, no, I like that shoe that you show as an alternative, especially in the initial stage to stabilize and protect, and then normally I would probably move in some type of a Pona, which also gives me the protection, cushioning, and already some lateral flexibility, especially in this case that it was mainly on turns that he was sore, and then from there move into a split shoe that probably would have been more my ideal approach with him. But again, you have to kind of also work with what the farrier is comfortable working with, what shoes he's used to work with, and what successes he had with in the past a little bit.
That's why it's nice in, let's say, 3 slides at the end. You want to take off the pressure or the leverage on that part of the hoof structure. So in your 4 stages, what you want to achieve, and you just give all the opportunities to the farrier, what he has in his backpack to use. That's a really nice thing. And just for the farriers or for the vets, if you want protection or support, how can you differentiate what type of shoeing you want to have on that horse? Is it protection in a way of a center bar, or does that horse need that support? Sometimes I use the 3D pads. 3D pads is well known, I think, nowadays. This is a 3D pad with a more pronounced frog here. So you can either use it like this, where that frog is really weight bearing, barefoot, before applying it, or you just use it underneath the shoe. And so that's making sure that the internal structures are nicely supported and they don't go down. So that when you apply a normal shoe, you always have at the end of your shoeing cycle, even after 1 hour, you always have a little bit lower PA just by applying a normal shoe because of the thickness of the shoe and no frog support. So every internal structure, deep digital flexor tendon, will already have a lot of stress if you don't support normal shoeing cycle. That has been shown by X-rays sequences.
Yeah, and I think that's one of the challenges that we face, and especially with the pathologies in the back of the foot like navicular or DDFTs, we all know that with traditional shoeing that you lose your by the end of your shoeing interval you lose hoof wall angle or coffin bone angle as the heels wear and the toes don't, and so that's where, especially in these cases, you have to see how can I a preserve that angle, and B, hopefully improve that angle over time, and which is the ideal shoeing package for that. And a frog support pad like that can be helpful to distribute the load and at the same time not put too much pressure on the navicular, I think, because that pad is quite hard, so that helps probably too a little bit, that you don't have that direct pressure on it.
Depending on the packing that you use, exactly.
Right.
If you have a shore, sorry, Joop.
Well, I was wondering, Bart, can you stop sharing, and can we invite the other people to join? Turn on their camera.
Sure.
and turn on their microphones, and that's now we see who's in the house. And I would like to provide an opportunity for people in the audience to ask questions to either Bart or DJ regarding this patient or regarding a patient that they've had themselves, that they might have some questions about. So the floor is to the people who are on the call. And
I'd be happy to make a comment or make it into a question. Great presentations and discussion between our Farrier experts. And what I like to encourage the farriers I work with to initiate on a heel sore horse is to provide more heel support without going to a bar shoe. And of course, we're oftentimes dealing with the front limbs, and I'm asking for, excuse me, a little bit of magic from the farrier and the horse to extend the heels of the shoe, potentially with a little wider web, and not use a bar shoe. And then that's one aspect. And then the other aspect is with the radiographic control, sure that we have an appropriate palmar angle. Potentially in some horses, raising the heels somewhat, even though we're risking crushing the heels if we continue that for too long of a period of time. Because many horses I deal with don't have direct hoof tester sensitivity at the frog, sometimes at the toe of the sole, but not at the heel. Yet the lameness is focused in the heel structures. So any comments from the farriers?
If I can just jump in there, that wide web heel soreness, if you use like that was a type of onion shoe that you were going at, I think. So there you give a little bit more protection on your heels. And yet in the soft footing, when you have that toe descending in the sand, you have a natural elevation of your heels where you have that overload, and at the end of time, you will have excessive wear on your heels. And that's where you don't, in a long-term thinking, you won't get a nicer angle. You always have to start over again and again. But in the acute phase, you will help that horse pretty much. But it's a short-term thinking or long-term thinking. And from my opinion here, I had a similar case here back in Europe, and I used the Epona shoes where I glued them with the Equilocks, and I made a little elevation in my glue. So at that acute phase, I had 2 times, I had protection of excessive wear. I could readjust the PA because of using more glue on the back part. And I also had protection of that complete structure, let's say when he was working in the soft ground or hard ground, because an egg bar or an onion shoe won't help a thing when rehabbing on hard surface.
Right.
Yes.
Okay.
I hope that's.
Yeah. Thank you.
Yeah.
Yeah, and I would agree. I think you have a lot of shoe options, but I think what I try to show it in this presentation that we have to evolve, because if you get stuck with just protection or just mechanically making the angle look good, you're always gonna have to do that, and the heel structure is gonna get weaker and weaker because you restrict it with a traditional shoe. So initially I used that in the acute phase, but then I tried to move out of that to see how can I develop a healthier part in the back of the foot, a better heel structure, so the angle corrects itself over time. And that's where barefoot can be helpful. Steve O'Grady has shown the results with that on hind limbs. And that's where the split shoes can be helpful. We've shown that in our clinical trials as well. And the biggest issue that, as Didier said, that farriers face is that these heels constantly want to wear over the shoe and the toe doesn't. So you correct them as a farrier, and then by the end of your shoeing cycle, you have to start over again. And we're trying to break that cycle by adapting our shoeing over time, and then creating a healthier foot that then will unload the navicular or the deep digital flexor in the long run. So over the years, I've been less concerned about how it looks now, because I want to make it look good in 6 months or 8 months. And if it doesn't look great in the first shoeing or the first 2 shoeings, I'm not too concerned about that, to be honest, when it comes from an angle perspective.
Yeah, and I really like the idea of modifying shoeing type based on progression of the horse's foot and comfort.
Right.
That's a great thing to remember.
Any other
think the-
questions?
yeah.
Any other questions from other people in the audience? I've seen a lot of head nodding, so it looks like you're telling something that makes sense. Any other experiences with changing shoeing over time in a rehabilitation, doing justice to the phase where the horse is in? Because my experience is that I hardly see that happen. I really like this approach a lot. That's why I was so happy that Bart and Didier were willing to join us in this conversation. More questions, or do Bart or Didier have questions for the audience?
I will have just one remark on that case, on that special case, and we have a lot of cases, similar cases. I think all of our farriers or veterinarians will have separate, likewise cases. Here it's just a matter of in what stage is that horse in? Is he now in a painful stage? We can adapt more in stabilization and protection, and then when he has a more sounder period, you can go back into that hoof health in trying to make that hoof exercise again and gain quality in hoof structure and internal structures again. Yes. That's for a question towards the other participants or attendees. Never change a winning team. In a way, never change a shoe that works for that horse. I think a lot of farriers, once you got the horse sound, you will stick with that shoe and you won't be able to change. Or it's because of the trainer, or is it because of the veterinarian that you have to deal with? That's a little question towards colleague farriers or veterinarians, doesn't matter. Or are you afraid to lose that customer because he can go lame again?
Agree with that's the hard part about changing, because often you get stuck as a vet and farrier by the trainer or the rider saying, oh, the horse is good, don't change anything. But change, we're always afraid of the negative, but often they can give you more positive, and we don't take that opportunity because we're afraid to change, because indeed maybe we'll lose a customer, or the owner doesn't want to do it, or the trainer doesn't want to do it. But I think it's critical for long-term health that we change the shoeing as the injury, the pathology, or the hoof changes, and that we have to look for a long-term health and not just focus on short-term health. I mean, short-term is important too, but that's why we have to always reevaluate what stage are we in. Is the initial reason why we put on this package, is that resolved and that we have to change now? Just like with this horse, he was foot sore, he was wearing too much barefoot, so he got sole sensitive. That's why the hard plastic pad was applied. But obviously after one shoeing, when you have sole depth back and he's not wearing uneven, then that hard plastic pad is not necessary anymore. Then you might just change back into a shock absorption pad or a polyurethane shoe. If you say, oh, now I need more shock absorption, I don't need that complete protection anymore. But often we won't change that package because the horse did fine, but the issue is resolved. So then you have to change and see what is the next thing we need to address. So you have your priorities within your healing a little bit, I think, and then you adapt the shoeing to that priority principle.
But I
Would
think
you consider? Oh, sorry.
No, go ahead.
Would you consider working that horse while he was a little bit off at some stage? He was a little bit off on the hard surface, but on the soft footing, he was pretty okay.
Yeah,
Would you consider
this horse, since I saw him stayed in work. I hardly take my horses out of work. I think movement is healing. In this case, I will tell the owner to avoid short circles to the left, because that's where he's lame. But he was pretty comfortable going right, and in the soft on a straight line he was comfortable. So this horse was ridden and moving all the time. He had some ups and downs during this process, which we also saw why, but the horse always stayed in work. I think it's critical. And again, for a hoof to get healthier, it needs to exercise. You can put any shoe on it. If the horse is standing in a stall 23 hours, that foot cannot strengthen and develop, and that's what we're after, especially with caudal heel pain. We want to develop the frog and the digital cushion, and if he's not moving, it's not going to happen no matter what shoe you put on.
And I think that's a development that we see in the rehabilitation of horses anyways, that we are not too afraid of exercising horses more, also with tendon or even with tendon injuries. And I think from a biomechanical point of view and understanding how tendons and muscles work, it does make sense. We just are afraid to do it. And I think in general, we should take our customers with these horses on a journey and understand and help them understand where we can end, what the most optimal outcome can be. And they can be very easily happy and satisfied. But if there are more opportunities, take them on a journey forward and help them to understand why you want to make that decision together with your farrier, or the farrier together with the vet. I think we have time for one more question. We're getting close to an hour, and we try to stick to an hour. If there are any more questions or remarks, please let me know. And if not, then I would like to thank Hilltop for organizing this. We do this every month. You're welcome to join us. Have a look on our website at Ignite, where you can become a member of our rehab rounds, where we will do this. We will have it recorded. You'll be able to watch all the periods back when it's convenient for you, not when you're driving or when you're on the way. Thank you for joining, and hope to see you next time. The next rehab rounds will be the 25th of this month of July, and on the 15th we will have a special rehab rounds, which will be completely dedicated to the Olympic Games in Paris, where we will talk with sport horse vets who prepare horses for Olympic Games this year and in the past. So thank you all for joining, and hope to see you again somewhere, sometime. And Bart and Didier, thank you for presenting this case. Bye-bye.
Great. Thanks for asking.